Hi, I'm Rafael Shamas, and I'm on the health and safety team at Milwaukee Tool. Today, we will be having a conversation with three construction health and safety leaders. In early March, when the country was asked to quarantine, many of you were told you were essential in keeping our nation's infrastructure running and were asked to keep working. Our industry was struggling to understand how to work while preventing the spread of COVID-19. Early research showed virus stability on hard plastics and metals for up to 72 hours, which is too long to leave a tool unused. To help you get back on the job safely, Milwaukee was the first in the industry to issue guidelines for proper cleaning and disinfecting protocols for tools to help prevent the spread of COVID-19. With state and federal authorities, trade groups, government agencies, and construction health and safety leaders recommending not to share tools unless you have to, these guidelines provide a way to properly clean them before they are shared again with others on the job. As states reopen and you continue to work or return to the site, we want to help you stay safe and provide you with a resource on how to get back out there safely. With three leaders in construction health and safety: Dr. John Howard, NIOSH Director; Chris Cain, Executive Director for CPWR and Health and Safety Director for the NABTU; and Dr. Scott Earnest, Director of Construction for NIOSH. While every state has not been affected the same, today's conversation is relevant to all trades and construction workers across the country. With that, I'd like to introduce Dr. John Howard. Dr. Howard serves as the Director of NIOSH, the National Institute for Occupational Safety and Health, and Administrator of the World Trade Center Health Program, a part of the U.S. Department of Health and Human Services in Washington, D.C. He first served as NIOSH Director from 2002 through 2008, and again from 2009 to present. In 2015, Dr. Howard was reappointed to an unprecedented third sixth term. Dr. Howard received his MD from Loyola University of Chicago, his Master's of Public Health from the Harvard School of Public Health, his Doctor of Law from the University of California at Los Angeles, and his Master of Law Administration and MBA in Health Sector Management from George Washington University in Washington, D.C. Dr. Howard is board certified in internal medicine and occupational medicine.
Thank you very much. And let's have my first slide, which is about COVID-19 and the workplace. My second slide gives us some naming information. COVID-19 is the abbreviation for the disease, where the name of the virus is SARS coronavirus 2. So COVID-19 is the disease, SARS coronavirus 2 is the actual virus. The origin of the virus is in some dispute, but it has a lot of similarity to bat coronaviruses that occupy a lot of the caves and Wuhan, China. My third slide on the coronavirus family tells you that most of the family are fairly benign viruses. There's 4 of them that actually cause the common cold. But in 2003, SARS coronavirus itself was a significant outbreak, a pandemic that involved the entire world. 8,000 cases, 800 fatalities. MERS, Middle Eastern Respiratory Syndrome, was another coronavirus, and now we have SARS coronavirus 2. My third slide, what is a pandemic? This is often very confusing. The important point to remember in these 3 elements is that the virus has to be novel. That means that none of us have ever seen it before, and we don't have immunity to it. And that's a very important factor. There also has to be sustained person-to-person spread in the community. And lastly, it has to be worldwide. And certainly now, this day, the 16th of June, we know that more than 180 countries are involved. My fifth slide is on COVID-19 basics. We know that it's primarily a respiratory disease, but it can affect other parts of the body in severe cases. The symptoms are primarily cough, fever, shortness of breath, and this very unusual symptom of a new loss of smell or taste, primarily because the virus infects the upper part of the nose. Actually, there are nerve endings from the olfactory nerve of the brain that gives us our sense of smell. So some people in various countries are using that as a sort of a symptom question. Have you lost your sense of smell? Some people only say yes to that, and they say no to cough, fever, and shortness of breath. The incubation period is about 5 days. About 100% of people respond by day 14, which is the number of days we often use for isolation and quarantine. We've seen lately some symptom cycling. People who are recovered will all of a sudden get fever again. And this is something that we're seeing lately. My sixth slide is kind of contrasting a very confusing thing, which is we know what symptomatic people are, but we found in the last couple of months that you can be asymptomatic. You can be infectious. In other words, capable of transmitting the infection, but not have any symptoms yourself. Now, that's basically two kinds of people. One is, well, you're just pre-symptomatic. In 1 to 3 days later, you're going to develop symptoms. Just happened that we caught you at the asymptomatic stage, the still infectious stage. And then there are people who are persistently asymptomatic. They actually don't come down with an illness. They go through their entire course of the infection asymptomatic. The existence of these asymptomatic but infectious people are ones that cause us at CDC to recommend cloth face coverings, for instance, for everyone. My next slide on infectious disease routes tells us there's really three major routes: the airborne route, the droplet route, and the contact route. We think primarily SARS coronavirus 2 is spread through droplets, but we can't forget about as this picture of a sneeze, in which there are about 50,000 particles that come out of everybody's sneeze, some of them very explosively with high velocities. They can travel quite far. My next slide on airborne transmission says basically the smaller the particle, the smaller what we call aerosols, the further they can get from a cough or a sneeze. And this is important because depending on the wind velocity, if you're in an office building and your ventilation isn't that good and somebody's sneezing or coughing around you, you're going to get a higher concentration. Fortunately, in most construction sites, they're out of doors, so you get more natural ventilation and the risk is lower. My next slide on droplet transmission basically tells us some of the particles that come out of a sneeze or a cough are larger and they fall closer to the source, the person who's coughing or sneezing. These droplets, if you happen to be within a short range of that individual and you don't have any protection on for your face or your eyes, you have no face mask, respirator, face shield, or any other protection, you're at risk. And then as we see in this same drawing, some of those can float away quite far away. We don't have any reports of what's called space-to-space spread. That's a true airborne transmission through ventilation systems. So my next slide gives us a picture of the first nanoseconds after somebody sneezes. As you can see, if you're standing real close to that person, you get all of those droplets. The next slide on aerosol settling and diffusion basically shows that the heavier aerosols are going to fall close to the source. But you see the other ones that are smaller and lighter and maybe carried by airstream is going to be a little further away. And then my next slide on diffusion and settling shows those smallest particles can get to the figure C there, which is quite far away from the source of the sneeze or cough. Meanwhile, the heavier droplets have dropped to the ground nearer the source. Now, my next slide on contact transmission basically says there's two kinds. You know, there's direct contact, and that's where a person, an infected person, coughs or sneezes directly on an individual. That kind of droplet transmission is a type of direct contact. But the most common, as we know, with tool use in construction sites is indirect. And that's where the virus moves from a susceptible person by way of an object or surface. So an infected person will perhaps sneeze or cough on an object, a surface, a doorknob, a tool, whatever. Susceptible person will pick up that tool. And then, most importantly, with their fingers, touch their eyes, nose, or mouth. And they have transferred the virus from that infected individual via the contaminated tool to their eyes, nose, or mouth. The virus doesn't have what we call wings or feet, so it depends on us to be transferred from one person to the other. Now, my next slide on testing introduces this concept of testing. My next slide gives you a very simple differential between what is a viral test, in other words, a test for the virus, and it tells you I'm currently infected, my viral test is positive, or a serology test, which is often referred to as an antibody test. And this basically says that, well, I've been infected. I don't know whether it was a week ago, a month ago, or whatever, but my body developed antibodies to the virus. And that's what is being picked up in a serology or antibody test. The next slide is a very complicated slide. But what I wanted to point out here is that all of these events are occurring in the body, and timing of testing is extremely important because you need to know where the person is in that sort of lifetime graph of the virus. And as you see, the curves that are in green there, the dotted line in green, that's a particular kind of antibody called an IgG antibody. That's what we're looking for, whether someone has developed that kind of antibody, because we're still studying that. We got to figure out whether people who have that antibody are immune to the virus. We don't know that yet. So let's look at the next slide on viral testing scenarios. Well, there's three major categories. One, obviously, people with symptoms. These people are tested. They're determined to be positive or negative. But there's a number of asymptomatic individuals that can be tested. The first group are people who, let's say, worked at the same work site with somebody who turns out to have COVID-19. They're a contact to a known individual, and they can be tested. But there are people who have no known exposure, And those are the kind where workplaces are thinking about, gee, should we test everybody, regardless of whether they have symptoms, regardless of whether they're a contact? And then the last scenario is where we try to figure out whether somebody who has been infected, been sick, can come back into work. So the next slide gives you a little cartoon of these three types of testing scenarios. Preventing entry into the workplace. That's the kind of testing where you may do for people who are coming back into a reopened workplace. Workplace testing can happen inside a workplace where you want to prevent the spread by testing contacts of a case. And then lastly, the returning safely type testing. So just briefly, I'll go through these three scenarios. The next slide on viral testing preventing entry into the work, what we're trying to do here is basically a type of hazard elimination. We do temperature checks, we do symptom screening. This is the kind of thing that happens. Now, you can use what are called point of care tests, rapid tests, to give you the answer pretty quick, or you could do laboratory tests where you take the sample and it has to go back to the lab. The next slide on preventing spread at work is that issue when a worker reports symptoms to the employer. Well, this is the time that we have to isolate the individual from the workplace, and we could do testing at that time. The next slide is the returning safely to work. And this is a complicated area, especially with regard to the guidance for folks who are returning to work who have had symptoms, they've had a positive test, they have COVID-19, and then we have to resolve all their symptoms. We may or may not test them again. And then there are folks who have had a positive test without any symptoms. How do we bring them back into work? These are all significant issues and a complicated area. The next slide is, again, going back to this antibody test, because what we want to figure out is whether these folks are immune. The next slide is, again, a complicated slide, a lot of information you may want to look at on the CDC website about antibody testing. But the point I want to make is in yellow there. The presence of antibodies cannot be equated with immunity from an infection. We don't know that yet. The next slide is gives you, it's from the White House material on COVID-19 testing, and it gives employers a lot of information about how you interpret both viral tests and antibody tests. The next slide is on therapeutics, drug interventions. Do we have anything that will work for this infection? The answer is no. There are no proven medications at the present time. But there are over 90 medications that are in active investigation, and these are just some of the categories. The next slide is on vaccines. As you know, testing vaccine comes in several different phases. There are safety and efficacy trials. There are lots of platform technologies that are being used now. The timeline is what everybody wants to know, but it's not anticipated that we'll have a virus vaccine before 2021. The next slide just gives you an idea. You know, normally it takes 10 or 15 years to develop a vaccine because all these phases are separated. They sort of occur sequentially. But what we're doing now is we're making all these phases happen at the same time. And that's what's speeding up, and in fact, the vaccine project for the United States government is a warp speed initiative. The next slide is, well, what are we after with vaccination? We're after what's called herd immunity, where there are so many people in the population that are immune that the virus can't jump from person to person because it jumps to an immune person on either side of an infected person. That's called herd immunity. You've got to get 60 to 80% of the population with that kind of immunity. The vaccine can do it easily if you vaccinate everyone. But of course, we have to remember that not everybody believes in vaccines, and vaccine hesitancy is going to be a barrier to vaccine update. And then the next to the last slide on the future, if you wanted to keep up with CDC guidance, then here's a website for you. It's a What's New website. I wanted to emphasize that I think we're going to hear more about workplace testing strategies in the next few months. And then the other issue that we're all very interested in, are we going to have a seasonality effect? In other words, will the virus come roaring back as the fall and the winter, as the 1918 influenza pandemic? And then the last point, I think we're already in that period of time when we're going to have to manage case spikes or contact spikes, not only nationally, regionally, but also in every workplace. We're going to have to identify the individual who has a COVID-19, identify all their contacts, trace their contacts, isolate or quarantine their contacts. Thank you very much.
Thank you, Dr. Howard, for that level of detail. It was tremendous. Now I'd like to welcome Dr. Scott Earnest. Scott serves as the Associate Director of Construction for NIOSH in the Office of Construction Safety and Health. Prior to joining the Office of Construction Safety and Health, Scott was an engineering branch chief in NIOSH's Division of Applied Research and Technology from 2005 to 2015. Scott has over 70 peer-reviewed publications and technical reports. He began his career as an active duty commissioned officer in the U.S. Army Corps of Engineers. He is a registered professional engineer and a certified safety professional. Scott has his master's degree and PhD in industrial and mechanical engineering. Welcome, Scott.
Thank you, and it's good to be with you this morning. We've been very busy in recent months addressing the hazards of COVID-19 in the construction industry as our nation returns to work. This has been a very encompassing and consuming effort, and as part of that effort, we've engaged with many key partners and stakeholders. We've been working closely through the NORA Construction Sector Council and a COVID-19 work group that we've established. Also, CPWR, the National Construction Center, has been playing a very key role. I'm planning to discuss the updated CDC NIOSH COVID guidance for the construction industry during return to work and how the hazard can be effectively mitigated. I'll touch on the work of the NORA Construction Sector Council and our work group, and then I wanted to point out some key web links that may be helpful for you as you seek additional information on this topic. Much of the approach to addressing the mitigation of COVID-19 involves exposure control methods. This approach is largely based on the traditional industrial hygiene hierarchy of controls. And as part of the hierarchy, in general, the most effective methods are at the top of the hierarchy and less effectives are near the bottom. Mitigation near the top includes things like eliminating exposures by staying home when you're sick. Engineering controls, including effective use of ventilation, air filtration, or air cleaning technologies, or just simply outdoor air. And then administrative controls could involve things like work rotations and reducing staff sizes for certain types of construction tasks. Lastly, at the bottom of the hierarchy is personal protective equipment, and that can include things such as face shields, gloves, and respirators to mitigate exposures. Next slide. There's a considerable amount of COVID guidance available on the web, and when you look at the guidance that's available, you can classify it into three main mitigation categories. Those categories include physical separation and distancing, such as staying home when you're sick, screening workers that arrive at the website, and maintaining social distancing of at least 6 feet. Use of personal protective measures, and this could include things such as proper cough etiquette, frequent hand washing, and wearing of face coverings. And then the final element is decontamination of surfaces. And so I'm going to get into some additional detail as we go to the next slide. The next slide is the front page of the construction guidance that's now on the CDC website. This information was posted several weeks ago, and CDC guidance is being regularly updated as we learn more about the virus. This page begins by providing some details on how COVID-19 is transmitted, which is primarily from close contact between people within 6 feet of each other. Next slide. Construction workers can protect themselves and stop the spread by notifying their supervisor if they have symptoms, following the CDC guidance if you're sick and staying home, also following CDC precautions if you have a family member that gets sick, and then again utilizing social distancing and wearing cloth face coverings or higher levels of protection if available when social distancing isn't possible. Next slide. In terms of construction guidance, some of the steps that employers should take include things such as providing accurate information to their employees about COVID-19, trying to take steps that reduce transmission amongst the workforce, minimizing face-to-face contacts on the job, and encouraging proper hand hygiene. Under the heading of maintaining a healthy work environment, some of the suggestions and recommendations on our website include modifying work schedules of construction workers, minimizing the number of workers that enter into confined areas on the job site, making sure that you conduct hazard assessments of each job that's being conducted, and then again, maintaining proper social distancing. Next slide. In terms of hygiene and personal protective equipment, some of the recommendations under that heading include not touching your eyes, nose, or mouth, because this is how the virus enters your body, wearing gloves and eye protection while you're on the work site, and again, wearing appropriate face coverings when you're in close contact with other construction workers. Next slide. It's also important to train your employees on proper hand washing of 20 seconds or more and using soap and water, or if that's not available, using alcohol-based hand sanitizers and making them available at multiple locations on the job site. Promoting hand washing or using portable hand washing stations on the construction sites, and then also developing cleaning and decontamination procedures for frequently touched objects. This could include things such as tools and equipment, vehicles that are being used on the site, door handles, handrails, and other items. I also wanted to say a little bit about decontamination and why decontamination is important, and that gets to the fact that COVID-19 can live on surfaces for hours or in some cases even days. And there have been studies that have shown viral RNA being detected after quite some time. So for example, on aerosols, viral RNA can be found for up to 3 hours. On copper surfaces, it can be identified 4 hours later. On cardboard, 24 hours later. Plastic, 2 to 3 days later. Stainless steel, 2 to 3 days. And on glass, it can be found 4 days after it's deposited. And so cleaning and disinfecting frequently touched surfaces daily is important. If the surfaces are dirty, clean them, use detergent or soap and water prior to disinfection, and then use a household disinfectant. And there's a list of EPA registered household disinfectants that are effective for COVID-19. Next slide. Under healthy business operations, we encourage each site to have a safety officer responsible for COVID-19 issues and for developing a plan. We also encourage use of flexible sick leave, providing information on who to contact if somebody becomes sick, and then lastly, communicating with local public health officials related to any local outbreaks. And then with my final slide, just wanted to point out that there's quite a few web links that could be useful. The first link is for the COVID clearinghouse that Chris is going to be describing in her presentation. There's also a link to numerous CDC websites, including information about construction in general, about the CDC construction guidance on the website. There's a link to the OSHA COVID-19 construction. And then finally, I wanted to mention the CDC has a 1-800 number. So if you want to actually talk to somebody about some of the issues or some of your concerns, you can call that 1-800 number and talk to a person directly. Thank you very much.
Thank you, Dr. Earnest. We appreciate all the insights that you've given us today. Now I'd like to welcome Cain. Chris is CPWR's Executive Director and leads its construction research, training, and service programs funded by federal agreements, grants, and contracts. She works with CPWR's partners in the government, unions, and the larger construction, safety, and health community. She also serves as the Director of Safety and Health for North America's Building Trades Union, the umbrella organization also known as the Building and Construction Trades Department at the AFL-CIO. NABTU is comprised of 14 national and international unions collectively representing over 3 million workers. She has been working in construction safety and health for more than 24 years. Welcome, Chris.
Thank you, Rafi. My slides are going to repeat some of the information you've already heard from Drs. Howard and Dr. Earnest. But I wanted to just start with this slide where towards the end of April, North America's building trades unions decided to take the guidance that we've been issuing since the beginning of the pandemic and its effect here in the United States and turn them into standards. And this basically was a shift to flag that these were some expectations that workers should have on the job to protect themselves or to be protected against COVID-19. And it all starts with a plan. An employer should have an exposure control plan for COVID-19. It's a hazard that exists on all job sites right now in this country, and it's recognized and it needs to be controlled. So the hierarchy of controls that Scott has already mentioned should be followed. There should also be somebody there for each employer in charge of the plan, and training needs to happen on all levels around COVID-19. So this hierarchy of control image is one that NIOSH produced, and it's quite good. Looking, as Scott described, looking at the top of the hierarchy of controls are the most effective ways to control any hazard, and towards the bottom are the least effective, kind of the last line of defense that people have against hazards on the job. So if we talk about elimination, we're talking about screening workers, and that means symptom-based screening, both by no touch or no contact thermometers on the job, as well as symptom screening. So workers who have symptoms of COVID-19 should be removed from the workplace and should be isolated, tested, and get better before they come back. Work disinfection is very important around areas where workers who have COVID-19 have been identified, and employers should participate in contact tracing with their health departments whenever possible, whenever they find someone who has COVID-19 on the job. So as we move down the hierarchy of controls, another set of controls is the administrative controls. That we would like to see more engineering controls in use in construction for this hazard. As mentioned, natural ventilation is a great way to reduce the hazard, and luckily a lot of our work is outside, so that plays into it. But as far as what we can do on the job, the implementation of administrative controls, including distancing. We've heard everyone knows about social distancing, physical distancing, creating at least 6 feet of space between workers by staging and staggering crews and reducing the number of workers in a given area. Modifying work schedules to stagger that work, or providing alternative work days, extra shifts, are all different strategies that we've heard are being used to help ensure physical distancing on job sites. In construction, the challenges are in those choke points, ingress, egress, where folks come in and out of a job site. If you're doing high-rise construction, traveling on hoists is a choke point, break areas, and transportation, moving workers from within a work site and also commuting together is our choke points where we need to address the distancing whenever possible. Also, administrative controls is cleaning. We've already talked about this in this webinar. So the cleaning and disinfecting of all high-touch surfaces, and ensuring that there's disinfectants on the job and available is something that should be part of any exposure control plan. Also, hand washing, another administrative control. So running water and soap is the perfect way to clean hands on the job, and use alcohol-based hand sanitizers if running water is not possible on the job. Again, workers should be encouraged to wash their hands and given time to wash their hands frequently throughout the day. At the bottom of the hierarchy is personal protective equipment. And this is something that's really central to CPWR's belief on how to control this. We think that workers working in close proximity to each other, if they cannot achieve physical distancing, need to be in NIOSH approved respirators under a complete respiratory protection program. One area where we differ from some of the federal guidance is that we don't think cloth face masks are a substitute for respirators when workers have to work in close contact with each other, like in confined spaces or in unavoidable close quarters. And respirators are not just N95 respirators. Here are some images of respirators that would be acceptable for workers who have to work in close contact near another potentially infected person. These are the designations N95, N99, N100, etc., that are NIOSH certified filters, and they can be filtering face piece respirators like the example in the lower right-hand corner of the screen, or they could be any elastomeric face piece, half face, full face, positive air pressure, negative air pressure respirators, as well as PAPRs. Next, I wanted to shift gears and talk a little bit about the clearinghouse that CPWR stood up in short order in response to this pandemic. This slide has the web address for the clearinghouse. It's www.covid.lcush.org. And what we're trying to do with this clearinghouse is to assemble as much information as we can that's vetted and trusted, both from CDC, NIOSH, OSHA, and other federal sources, but also from employers who have developed great model programs, training programs that exist out there. State and local requirements are driving what construction employers have to do across the country, and they're driving it in a lot of different directions. So we're trying to collect and make available as many of these state and local requirements as we can. So these are the categories of the resources we have in the clearinghouse. Guidance on workplace practices, safety and action is one that I'm really interested in getting examples and populating this part of our clearinghouse, because we know we need to keep physical distancing and we know we have to have hand washing facilities, but sometimes some of these things are challenging in construction. But we're hearing and we're seeing employers who are doing this. So we're trying to find small, specific examples of how to maintain distance at choke points. How do you deal with the hoist choke point? How do you deal with ingress and egress? So we're collecting images and stories and putting them in the clearinghouse for other employers and workers to have access to. All of the training resources we can find, videos, presentations, toolbox talks, etc., are in the clearinghouse now, and we're adding more. Recommendations and requirements, such as the standards that I previously mentioned, as well as other requirements, are in the clearinghouse. The state and local requirements I mentioned, we're collecting as many as we can find, and we ask for your help in finding those. And then research findings. When we find good peer-reviewed studies or reports or data on the spread, on the impact, and on prevention, we're trying to post links to those studies. One great thing that's happening now is that almost all COVID research that is being published in peer-reviewed literature is available for free. You don't have to pay for the articles right now. So we're trying to link to as many good studies as we can find in one place. Information on personal protective equipment is in there, as well as mental health resources. When this pandemic started, we were very concerned for the mental health of construction workers and their family. We have a serious situation in construction where fatal opioid overdose is experienced at 6 to 7 times the rate of the general population, and suicides are an epidemic proportion in our industry already. So we thought we needed to collect mental health resources for folks to use, given the added stress and uncertainty that we have during this pandemic. And also things like this webinar, we will link to the clearinghouse, and we try to link as much information as we can through social media and webinars, including a webinar we did with Dr. Howard early in the pandemic, as well as a series of webinars that CPWR and NIOSH are partnering on. So we ask your help. We'd love it if you would submit content so we can consider it for the COVID-19 clearinghouse for construction that we've established. We've established an email address, covid19@cpwr.com. Send us an email if you have information on some of those helpful tips on how to implement social distancing, or you learned of a new state regulation that was issued from your governor's office. We'd love to hear from you, and we'd love to post it if we can. So please send us information to covid19@cpwr.com. And that is the end of my prepared remarks. Thank you.
Thank you, Chris. Thank you for sharing the information and the resources. Now I'd like to move on to our Q&A portion. Our first question: explain the difference between cloth face coverings and N95 respirators. When cloth face coverings are used on construction sites during the hot summer months, some workers have commented about overheating. What do you suggest being done to address this issue?
Sure. Thanks for that great question. Really, the difference between cloth face coverings and N95 respirators, or any respirator, is that the respirators are certified by NIOSH. And so because they're certified, they have to go through a testing process, and there's actual OSHA regulations that govern the use of respirators and respiratory protection in the construction industry. So if a respirator is being used, they should be in compliance with all OSHA regulations related to personal protective equipment. And this includes CFR 1926-103, which requires a written respiratory protection program, medical evaluation of the individuals that are wearing the respirators, and proper fit testing. And the reason for the fit testing is to ensure that there's not bypass around the filter media. If you're wearing a respirator, you want all of the airflow to go through the filter media to filter out any airborne aerosols. The cloth face coverings, on the other hand, it's not regulated by OSHA under CFR 1926-103, and those are intended primarily to prevent. It's for source control. So if you have an individual that has to work in close proximity to another construction worker and they're coughing or sneezing, if everybody in that area is wearing a cloth face covering, that the cloth face covering will prevent the droplets from hitting other workers that are within 3 or 6 feet of that worker. So that's the primary difference. And then as far as the issue of heat and the issues of heat stress during the summer months, if you're wearing either respirators or cloth face covering, it's really similar to any other sort of situation in construction, where if you're wearing respirators or cloth face coverings in the summer, you want to make sure that you take into consideration the potential for heat stress. You want to make sure that the workers are being properly hydrated, and you want to give them periodic breaks so that they can get out of the heat and prevent heat stress. Another issue that's come up from time to time is the issue of fogging. So if you're wearing a respirator or a cloth face covering in the heat and you have glasses on, there's a potential for fogging up. And there's a lot of different measures that can be taken to prevent fogging of glasses, such as putting certain types of substances on the glasses to prevent that.
What are some changes you've seen in the construction industry as a result of COVID-19?
Well, Thanks for asking that question, because we are seeing changes, and we're seeing changes from all over the country. I heard from a contractor, a masonry contractor in the New Jersey, New York area who worked throughout the pandemic, and changing the way that his crews were scheduled, changing just planning more, providing extra personal protective equipment, the provision of hand washing equipment. In his case, he described that it was kind of tough to get used to the new normal, but he was able to measure productivity return to pre-pandemic levels in about 3 weeks after implementing the controls, and he hasn't had anyone become ill in New York. So it's really encouraging. We're also hearing from contractors who are reporting that the general contractor who's controlling the site is providing more hand washing facilities. They're providing more bathrooms, and everything is clean. And that is something that's really unusual in their view, that things are really being taken care of. People are disinfecting, people are cleaning. And we are hearing creative ways to ensure that physical distancing occurs amongst workers. There was a report of the use of new lifting equipment and different ways to manually the use of different lifting equipment and different ways to handle materials that didn't involve close contact. So they were able to, hopefully reduce ergonomic stressors for the workers, as well as provide lifting devices and keep their distance in some typical tasks that would have taken a 2-person lift to accomplish. So those are the main things we're hearing about, and we want to hear more, of course.
Thank you, Chris. We have a lot of subcontractors coming in and out of job sites across the country. What steps do you recommend be taken in response to COVID-19 for contractor access?
Sure. Another great question. And this is extremely common on most construction sites. Anytime you've got a large number of people that are coming and going from a site, you got to have a system in place to conduct screening and assessment of those people. And you don't want people just showing up onto the construction site if they're not being screened, because you don't want somebody showing up who has COVID-19 and is spreading that to other workers on the job site. So in order to do that screening, the system should involve visual scans and temperature checks, safe screening for the individuals that are actually conducting the screening, developing a criteria for home isolation when somebody becomes sick. And this can be test-based or symptom-based. And then lastly, you need to have some sort of a protocol for return to work. So if somebody on the site does get sick, the steps and the procedures are going to be followed for how and when they would return to work. Thank you.
Thank you, Dr. Earnest. Why did CPWR start posting guidelines for the construction industry, and why did you change them to standards?
Well, that's a good question. We started to get questions really early on in the days leading up to the declaration of a pandemic. And luckily, the CDC had started issuing some guidance and some pointers for the general population, things about don't shake hands, use physical distancing, things like that. So what we tried to do was take those and kind of translate them for the construction industry. So in early March, we started posting, this is our guidance, and we started sharing it with people who were asking us. Over time, it became more than just restating the CDC guidelines, but how do you actually implement some of those in construction? And we've never tried to be comprehensive. That's not what we've tried to be, but really just trying to keep up with the science, trying to keep up with what the government was saying, and truthfully trying to keep up with what the government wasn't doing. We had a lack of information from OSHA on how to keep construction workers safe in the early days. So the leadership at NAB2 decided we need to, elevate this, and we need to create more of a standard of expectation for construction workers. And that's when I was April 27th, we switched the guidelines that we had been updating and developing over the almost 2-month period and called them a standard. They're still guidelines. They're not enforceable by any law, but they're a set of expectations that workers should have when they're working on the job and controls that the employer should put in place.
Thank you, Chris. Should a company or organization have a written pandemic plan in order to reopen when their states allow for it? If yes, what should be included in the return to work plan?
Thanks. Another great question. And the answer to that's very simple. The answer is yes. You definitely need to have a written plan, and you need to have a person designated on each construction site to oversee the implementation of that plan. Some of the key elements that you want to include in that plan is a risk assessment, job by job, looking at each job and things that need to be taken into consideration to prevent disease transmission of COVID-19. You also want to have education and training as part of that plan so people understand exactly what the hazard is and how to prevent it. You want to include social distancing, looking at the entire job site, in particular, honing in on areas where construction workers have to be in close proximity to each other, making sure that there's provisions for face masks and PPE or respirators, cleaning and disinfecting being done on a routine basis, especially areas that are things that are being touched frequently by many different workers, and then a plan to conduct on-site screening, as we talked about before, so that you don't just have folks showing up to the site who could be sick and spreading the disease. You want to screen everybody coming to the site. Thank you very much.
Thank you, Scott. Thank you to our panelists, Dr. John Howard, Dr. Scott Earnest, and Chris Cain, not only for your time today, but also for your continued leadership in driving health and safety in our industry. Also, thank you to the CDC, to NIOSH, and to CPWR for sharing your leaders with Milwaukee Tool and with contractors all over the country today. We want each of you to stay safe and stay productive out there on the job site. For additional resources to navigate the COVID-19 pandemic, visit these sites. Thank you for listening, and please continue to share your stories with us using Together We Stand.